Ladies and gentlemen, boys and girls, me Dr. Deepika
And me, Dr. Vinay.
welcomes you all to the new episode of Divyarishi Arogyam Sansthan.
Nowadays, dengue is most prevalent viral infection which causes many deaths every year, but it can be prevented by simple measures. So today we will discuss what is dengue, its causes, its symptoms and its prevention. Dengue is a mosquito-borne viral infection, the infection which causes flu-like illness and occasionally develops into a potentially lethal complication called severe dengue. The global incidence of dengue has grown dramatically in recent decades. About half of the world population is now at risk.
Dengue is found in tropical and subtropical climates worldwide, mostly in urban and semi-urban areas. Severe dengue is a leading cause of serious illness and death among children in some Asian and Latin American countries. There is no specific treatment for dengue or severe dengue, but early detection and access to proper medical care lowers fatality rates below 1%. Dengue prevention and control depends on effective vector control measures.
Dengue is a mosquito-borne viral disease that has rapidly spread in all regions of WHO in recent years. Dengue virus is transmitted by female mosquitoes, mainly of the species Aedes aegypti, and to a lesser extent Aedes albopictus. This mosquito also transmits chikungunya, yellow fever and Zika infection. Dengue is widespread throughout the tropics with local variations in risk influenced by rainfall, temperature and unplanned rapid urbanization.
Severe dengue, also known as dengue hemorrhagic fever, was first recognized in the 1950s during dengue epidemics in the Philippines and Thailand. Today, severe dengue affects most Asian and Latin American countries and has become a leading cause of hospitalization and death among children and adults in these regions. There are 4 distinct but closely related serotypes of the dengue virus that cause dengue: DENV1, 2, 3 and 4. Recovery from infection by one provides lifelong immunity against that particular serotype. However, cross immunity to the other serotypes after recovery is only partial and temporary. Subsequent infections by other serotypes increase the risk of developing severe dengue.
Now we will discuss what are the characteristics of Aedes aegypti. The Aedes aegypti mosquito is the primary vector of dengue. The virus is transmitted to humans through the bites of infected female mosquitoes. After virus incubation for 4 to 10 days, an infected mosquito is capable of transmitting the virus for the rest of its life. Infected, symptomatic or asymptomatic humans are the main carrier and multiplier of the virus, serving as a source of the virus for uninfected mosquitoes. Patients who are already infected with the dengue virus can transmit the infection for 4 to 5 days, maximum 12 days, via Aedes mosquitoes after their first symptoms appear. The Aedes aegypti mosquito lives in urban habitat and breeds mostly in man-made containers. Unlike other mosquitoes, Aedes aegypti is a daytime feeder. Its peak biting periods are early in the morning and in the evening before dusk. Female Aedes aegypti bites multiple people during each feeding period.
When we talk about Aedes albopictus, it is a secondary dengue vector in Asia and has spread to North America and more than 25 countries in the European region, largely due to the international trade in used tires, that is a breeding habitat and other goods, example lucky bamboo. Aedes albopictus is highly adaptive and therefore can survive in cooler temperate regions of Europe. Its spread is due to its tolerance to temperatures below freezing point, hibernation and ability to shelter in microhabitats.
Now we will discuss about the characteristic symptoms of dengue. Dengue fever is a severe flu-like illness that affects infants, young children and adults, but seldom causes death. Dengue should be suspected when high fever of 40 degrees Celsius or 104 degrees Fahrenheit is accompanied by two of the following symptoms: severe headache, pain behind the eyes, muscles and joints pain, nausea, vomiting, swollen glands or rash. Symptoms usually last for 2 to 7 days after an incubation period of 4 to 10 days after the bite from an infected mosquito.
Severe dengue is a potentially deadly complication due to plasma leaking, fluid accumulation, respiratory distress, severe bleeding or organ impairment. Warning signs occur 3 to 7 days after the first symptoms in conjunction with a decrease in temperature below 38 degrees Celsius or 100 degrees Fahrenheit and include severe abdominal pain, persistent vomiting, rapid breathing, bleeding gums, fatigueness, restlessness and blood and vomit. The next 24 to 48 hours of the critical stage can be lethal. Proper medical care is needed to avoid any complications and risk of death.
Now when we talk about the treatment of dengue, first we need to educate ourselves that dengue is a viral disease which is caused by the bite of mosquito. So prevention from mosquito bite is the foremost step which need to be implemented in every household, as there is no specific treatment for dengue fever. The dengue virus, one of the most dangerous disease caused by mosquitoes, can be prevented if one takes proper care. The simplest way to stay safe from this disease is to ensure that mosquitoes do not breed in your surroundings. First, keep your house clean and tidy. Do not leave stagnant water lying anywhere in or around your house. It's very dangerous as these mosquitoes lies on the stagnant water only. It doesn't matter if it is dirty or clean.
Besides this, spray the house with anti-mosquito sprays every day in the corners of your home to kill the hidden mosquitoes. Keep your wet garbage separate and throw it in a wet bin which is kept covered. In the rains, the chances of you getting infected by the dengue mosquito are extremely high due to the level of stagnant fresh water increase. At this point, all safety measures should be used. Try to wear clothes that don't leave any skin areas exposed. Wear a mosquito repellent cream and carry it with you with all the times. Keep the doors and windows of the house closed, mostly early in the morning and during the evening. Change your hand towels after a day use. Keep your wet and soggy clothes and shoes away from the dry garments. Also, try to dry the wet ones as soon as possible. It's not only about keeping your homes clean. We need to keep our area and city both clean.
The mainstay of treatment is timely supportive therapy to tackle shock due to hemoconcentration and bleeding. Close monitoring of vital signs in critical periods between day 2 to day 7 of your fever is very critical. Increased oral fluid intake is recommended to prevent dehydration. Supplementation with intravenous fluids may be necessary to prevent dehydration and significant concentration of the blood if the patient is unable to maintain oral intake. A platelet transfusion is indicated in rare cases if the platelet level drops significantly below 20,000 or if there is significant bleeding. The presence of melena may indicate internal gastrointestinal bleeding requiring platelets or red blood cell transfusion.
People who suffer from dengue fever have no risk of death, but some of them develop dengue hemorrhagic fever or dengue shock syndrome. In some of these cases, death can occur. If a clinical diagnosis is made earlier, a healthcare provider can effectively treat dengue hemorrhagic fever using fluid replacement therapy. Adequately management of dengue hemorrhagic fever generally requires hospitalization.
In our upcoming videos, we will bring the home remedies for dengue.
If you like our episode, please like, share and subscribe to our channel.
And yes, don't forget to comment. If you are suffering from any problem and not able to find solution for the same, you can visit our description section and by clicking on the link, you can find solution for the same.
If you want to meet us, kindly note down our address.
Divyarishi Arogyam Sansthan, C9 by 35 first floor, opposite Metro Pillar number 382, Rohini Sector 8, Delhi, 110085.
You can also write to us on info@divyarishi.com. Bye.